Council on Aging, serving seniors. Council on Aging. Council on Aging, serving seniors. Council on Aging, serving seniors. Council on Aging, serving seniors. Council on Aging. Council on Aging, serving seniors. Council on Aging, serving seniors. Council on Aging, serving seniors. Council on Aging. Council on Aging, serving seniors. Council on Aging, serving seniors. Council on Aging, serving seniors. Council on Aging. Council on Aging, serving seniors. Council on Aging, serving seniors.
Welcome to another Tuesday edition of the Lotus Zone. Say hey, Trudy.
Hello.
We hadn't been in the building for a minute, so
I know,
seniors,
we
so glad.
miss you.
We so glad to be back. Hey, seniors, we back. We back on everything. We look. We put in 2 weeks of work. We got all kind of IT people around here fixing it, so we think we got it together today. We want to give a great big shout out to Aaron and the Edge One and Cox and everybody who put us back on. Sean, Avant-Garde. So we back in the building. And so you let us know when you call if you hear us loud and clear. Anyway, today show is to educate, enlighten, and entertain and engage seniors and their caregivers. And today, y'all, I am so excited. We have a very, very, very special guest, Dr. Courtney Phillips, the secretary. I'm talking about the state secretary of the Louisiana Department of Health and Hospitals. How many of y'all get to talk to a secretary on a good Tuesday?
Wow.
How many?
We special.
We special. What's the quote for today, Trudy?
All right. Quote for today. Waking up to see another day is a blessing. Don't take it for granted.
Don't take it for granted.
Make it count and be happy
Make every day count.
that you're alive.
That you're alive. That's all right.
Yes.
To be alive is to be a blessing.
Amen.
Tim, you got a quote for us,
Amen.
Tim? You on with us, Tim, or you just gonna be over there
Timothy.
Instagram and scrolling?
No, I do
Tim,
have a quote.
you have a quote?
Yes, never regret a day in your life. Good days give you happiness, and bad days give you experience.
Oh, all right. I'm full of experience then. I'm full of experience then. Okay, today's show is sponsored by, who we got?
We got Care South Medical and Dental,
A number one from day
Yes,
one.
day
A number
one.
one from day one.
First Financial Group.
Mm-hmm.
We have People's Health
Mm-hmm.
and United Healthcare.
And United Healthcare.
So
Yes, indeed. So we want to thank all our sponsors. If you're
Yes.
interested in sponsoring the Lotus Zone, participating, being a guest on the Lotus Zone, talking to the seniors, call us. Now, Trudy,
all right.
well, we've been in the vaccine business, huh?
Vaccine, we taking care of the seniors.
We taking care
That's
of the
what we
seniors.
do.
And let me just say this, seniors. We do not have the vaccine.
Right.
We are not a healthcare provider, but what we do have is access to you.
Right.
And so we've been trying to put you in contact with entities that can get you the vaccine. And so we were blessed and privileged to have a pop-up clinic at our Lotus Center, about a week or two ago?
About a week ago.
A couple of weeks ago, with Albertsons that was put on by the because of Mayor Sharon Weston Broom. Let's give a great shout out to our
Yes,
mayor.
Thank you.
Made this possible. City of Baton Rouge, MOSIP, and also Albertsons, right?
Yes.
And us. And we did it over at 1701 Main Street. 3 days we vaccinated close to 1,000 seniors, 70 and up. And it was really, really, really a successful event.
Right.
And we're getting ready to do our second dose on a lot of folks. And the great thing is, Trudy, we had both types of vaccines, Pfizer and Moderna,
Oh,
right?
wow. How
So,
lucky.
how lucky.
Yes.
And we were so grateful and thankful
Yes.
that they were able to do that. And then this last Friday, we did another quick pop-up vaccine for the seniors in the Zachary area.
Okay.
Because we had
All right.
a cancellation
That's
on
right.
something that we were doing with them. And we did them this past Friday,
And
100 Moderna vaccines,
okay.
right?
Right. And big shout out to Albertsons.
Big
for
shout
that.
out to Albertsons.
Yes.
They filled in a void in the gap. And we have to thank LDH, who made sure that
Yes.
Albertsons had enough to assist the seniors with their vaccines.
Big
so,
thank yous.
so great big thank you to them, right?
Right.
All right. And then now on Thursday, we'll be doing one more 100. Just 100, a
just
small
100?
vaccine in the North Baton Rouge area at the Jewel J. Newman Senior Center for
Okay.
70 and above. And so if you attend, we have been giving you the sign-up sheets.
Mm-hmm.
You should have gotten it today in lunch, and you should have filled it out, turned it in. If you have not, and you're 70 above, and you missed, and you didn't go get lunch today from Jewel J. Newman or from Flanaker or from
Greater
King David,
Right.
Charles R. Kelly,
Yes.
any of those, even Martin Luther King. If you didn't get a chance to turn in yours, you could call, right?
Yeah, just call.
225-923-8000.
And ask to speak to one of our care managers.
You can ask for the Information and Assistance Management Department, INA for short.
INA.
You can ask for the care managers. And if you can't get them, you can always ask for Shan. Ask for
she's
her
gonna
by
get
name.
you.
She gonna kill me. But y'all call and y'all ask for Shan and say, Shan, see if you got one left. I need to get one. You have to be, 70 and above. We know what the CDC said. We know they said 65 and up. But right now, it's 70 and up is the group that we've been working with.
Right,
and so
right.
if you're not 70 and up, please be patient, right? Be patient,
Yes,
because
your turn is coming.
it's coming, and we're
Yes.
going to make sure that you have access. We're going to do our best, to make sure that everybody has access and an opportunity to get vaccinated in their area, right?
Right.
Because that's been some of the issues getting vaccinated in their area. So we'll most definitely talk to Secretary Phillips as it relates to some different approaches to getting vaccinated in your area, right?
Right. That's
What
good.
you got, Trudy?
All right, so
What's
we
the
have
count for today?
some updates for today.
Mm-hmm.
We have 2,654 new cases today.
As of today.
As of today.
Mm-hmm.
As of today. We have 31 new deaths.
Mm-hmm.
Ooh.
1,600
new patients that are in the hospital because of this virus. Goodness.
So now I saw on the news this morning
okay.
that they were saying that we are down in positive cases,
Mhm.
but up in hospitalizations, right?
Right.
So let's continue, seniors, particularly seniors, continue to be diligent, wearing your mask.
Yes. Do
Uh,
not get too comfortable.
Don't get comfortable. Don't get
Right.
comfortable with your loved ones, with your grandkids, and your family members. Wear your
Mhm.
mask.
Wear your
Social
mask.
distance. Don't hug everybody. Don't start that hugging and kissing again. Can't do that just yet.
Not yet.
Not yet, right?
Not yet.
Don't go where you don't have to go. Limit your outings. You have to limit your outings, right?
Right.
So that you can make sure that you're staying safe, right? And then what else, Trudy? Wash your hands.
Well, yeah, wash your hands, please. Social distancing.
And I've
Tasha
been
just
looking at-
expressed that.
I've been looking on the news. They
Okay.
starting to talk about double masks.
Double mask.
So when the
right.
secretary gets here, we're gonna mention that because we don't want no seniors to be suffocating and falling out.
right.
Because they done put
and
on
wearing the wrong mask.
and they doubled up 2 masks,
Yes.
2 N95s, and you can't breathe.
Can't
and
breathe.
I don't know.
Could
We
barely
got,
wear this one.
right.
That's so true. That's
So we got to
true.
figure out how that's supposed to go, how that's going to work.
That would be a good.
So
great
Jules J.
question.
Newman is Thursday, January 28th. The Jules J. Newman vaccines will be Thursday, January 28th.
At 10 o'clock.
Limited supply. We're going to do 100 seniors, and it starts at 10 o'clock, right? First
Right.
come, no, by appointment only, right?
By appointment only.
Right.
Right.
So look, we're going to keep diligent. We're going to keep mindful. We're going to keep our eye on the prize as it relates to the coronavirus and keeping ourselves safe.
Yes.
We're going to make sure we keep ourselves safe. And we're going to make sure, too, seniors as a whole and as an agency, that we keep those families in prayer
Yes, keep
who
them
have
uplifted.
lost loved ones, seniors that we have lost due to COVID, because we have lost some. We lost some last week. We want to send a prayer out and our condolences to Miss Nancy Phillips'
Miss
family.
Nancy,
Miss,
yes.
remember Miss Phillips?
Yes.
Um,
Very
she-
active.
Very, very active with the
Yes,
Florida
Florida
Boulevard
Boulevard.
Senior Center.
That's right.
And so, and Mr. Eric Green.
Yeah, Mr. Eric
But
Green,
I don't know.
advisory board member.
Our advisory board member. We
Right.
lost him last week. And
Right.
so y'all just, stay prayerful, stay diligent.
Call your loved ones. Call your teammates. You call your dance partners, your church members.
And
Check
do
on
it
everybody.
Yeah, check them. Look, and stay on the
Yeah.
telephone. Don't go to their house.
Yes.
Don't go to their house.
Yeah.
All right, now let's get to some agency news, right? We got some agency
Yeah.
news because we're gonna have Dr. Phillips on in about
In about
2-3 minutes.
Yes,
so
so we gotta
we're
go
gonna
to
take a break.
a short break.
Short break, and we're gonna bring Dr. Phillips on. She'll be calling in because she is social distancing, so she's not gonna come into the studio.
Right.
So she's gonna dial in, and we're going to talk to her.
Mhm.
And we have your questions, seniors, and it's some great questions. Let me tell you,
Yes.
y'all asked some awesome questions. It's so many. I don't know. We're gonna get to them all.
We're gonna try.
We're gonna try though.
Yes,
I'm gonna
we're gonna
ask
try.
her to bear with us and see if we can answer a lot of your questions. And so I'm gonna limit my talking to her, but so we'll just ask her some basics and just get straight to her questions. But let me just say some good news for the Council on Aging. We are one step closer to finalizing and closing on our Lotus Village.
Yeah.
If you know, Lotus Village is a $22 million project that we have been in, that has been in the works for nearly a year.
A year.
Right? 116 units located in the what you call the old lakes or
Lake.
suburb Gracie subdivision, right? And so we'll be closing on that here shortly.
Yeah.
And we're just excited. We're excited. We could not have done this without our partnership with Gulf Coast
Coast.
Housing
Yes, thank
partners
you.
out of New Orleans. They are the developers. Listen, I know y'all been calling. I've been getting inboxes and text messages that you want to be on the village, right? You want to move in the village. And so we don't have a waiting list. You can do a housing inquiry. You can call and you can ask for Jonathan and he'll tell you how to do
Our
the
super
inquiry.
social
Our super
worker.
social worker, Jonathan McGee.
Yes. Yes.
225-923-8000 for everything Lotus Village. But look, we're supposed to start Lotus Village in the spring. Start building in the
Yes,
spring.
March,
So I'm
April.
really, 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 really excited. And I would be remiss, right, Trudy, if we wouldn't thank the city of Baton Rouge.
That's true.
Because they have committed some things.
They've been
some-
working.
They've been working.
Yes.
We're going to get some new sidewalks in the area and some new infrastructure, drainage. And
Yes.
we might even get some street signs and some stoplights, all kind of
Ooh.
stuff. So we want to send a big shout out to Mayor Broom. When
Yes,
y'all see it,
thank you.
tell her thank you from the Council
Thank
on
you for
Aging
working
and,
for the
and
seniors.
What else we got?
All right, February 5th. Seniors, we're going to wear our red for what?
Valentine's Day?
No, American Heart
Oh.
Association. The American Heart Awareness, Heart Disease Awareness, February the 5th. Wear your red.
Okay.
Now, the marketing team is going to be asking you on Facebook to take your pictures and put them on Facebook, and they might do a little contest. So
And whoever had the best picture getting the TV.
they're getting the TV.
If you got the best picture in red,
Now, you heard it from our CEO.
that's right. Write it down, Angela. You're getting the TV. Not no anybody TV. You're getting one that's got some apps, and not like this one we got. Whoever win, you're gonna get a big flat screen TV. So look, I'm
All
looking
right.
for you in your red dusters with the red slippers.
Oh.
I want to see some Daniel Greens come
What
out
about
the
the
closet.
red bonnet?
Red bonnets, just surprise me. You got to be all the way
Oh,
red.
yes.
Red earrings,
Let's make
red
this thing
fingernail,
fun.
red toenails. You got to come all the way correct
Right.
if you want to win. So
Don't
look,
worry, seniors. The staff gonna be dressing up as well. So
That's right.
we want to have fun with you.
Trudy, you can't win.
What?
You
A
always try to
TV?
win. You can't win. All right,
Okay.
what else we have?
All right. So you know the Heart Day is coming up, February 14th.
We wearing pink for AKA?
No. I didn't say that, Mrs. Pratt. This is for Valentine's Day. So the marketing team and senior center coordinators want you to dress in red again.
We're going to be red for the month of February.
But be creative. Make a Valentine's sweater or something. I don't know.
Make a sweater, Trudy.
Put some hearts on it.
Oh, okay.
This is another contest.
For Valentine's?
For Valentine's, yes.
Oh, stick chocolate all over yourself.
Or roses.
Oh, roses, right.
Oh,
Seniors can't go
roses.
out. We just told them not to
Yes.
go out.
Do not go out. Stay inside.
Right. So how did, okay.
Just
wear
be
red.
creative.
Uh-huh.
Be creative.
Or what you could do is take a picture of you and your boo. All right. We're going to take a quick break. Dr. Phillips is calling in. We're going to take a quick
Yes.
break. And when you come back, you'll hear all about Dr. Phillips. But look on the screen because we got a garage sale coming up too. Hold on. We'll be right back.
Be
All
right back.
Thank you.
Council on Aging, serving seniors. Council on Aging, serving seniors.
All right, we are back. We are back on the air. We're back on Facebook, Instagram, YouTube, and the website. And we have the director, the secretary of the Louisiana Department of Health, Dr. Courtney Phillips. Hello, Dr. Phillips. How are you today?
I'm well. Thank you guys for having me and giving me the opportunity to speak today.
We are so glad to have you. Why don't you we're going to jump right into it because we know we have you for a very short period of time. Can you tell us just a little something about yourself? Because we don't ever get to see you. You are behind the scenes secretary. So why don't you tell the seniors a little bit about yourself?
Absolutely. So I'm Courtney Phillips, born and raised in Louisiana. I'm from a small town south of New Orleans. I started my career here with Louisiana Department of Health and Hospitals at the time. And then I took a role in Nebraska leading their state health department and then on to Texas before coming back home to lead for having the pleasure of leading here in Louisiana. So I'm excited to be here. It was an interesting time to jump in. I started this role in April, and it has been guns blazing since.
So, Dr. Phillips, can you tell us or give us, why don't you set the stage of where we are as a state as it relates to COVID?
Yeah, before I jump in, I do want to thank, just your team, you personally, your team, for all the work y'all are doing at the Council on Aging.
Thank you
I know that this has been a difficult time just for the state in general, but particularly for our seniors, as it's been a time that folks have been, unable to see family, have interaction, probably spend as much time at the center as they have. Right. And it's just been a challenge. And I know y'all have been doing some things to try to keep things interesting and creative,
sure.
A lot of online things. So I hear about a lot of things that y'all are doing on the ground to try to keep seniors engaged. As we know, mental health does set in. So I do want to thank you all for the work y'all are doing.
Thank you
just
so
to
much.
Jump in terms of where we are as a state with COVID. So today we reported out 2,654 additional cases, and that brings our state total to a little over 388,000. Unfortunately, we did report out an additional 31 new deaths, and that brings us to a total of 8,621 residents here in Louisiana that has lost their lives to COVID. And I want to say that number again because sometimes we hear the numbers reported out just daily, and we forget that these are our families, loved ones, our colleagues, our neighbors, and it's really important. 8,621 individuals have lost their lives in our state.
Wow.
And it's up to us to do better. We want to try to reduce that as much as possible, but it's going to take all of us coming together to make that happen. And so, we've been in this fight for quite some time. We've been focused on the mitigation efforts. There's a lot of, conversation on the rise around the vaccine, but the mitigation efforts now are just as critical as they were before. Even more so now as we're in this third peak. We've also seen a couple of new strains that pop up, and so we really can't let our guard down at all with COVID-19.
That's a great point, and you're right. What happens is I think we have gotten maybe a little used to just getting the numbers and not equating that to people's lives. That's so right. Thank you for that reminder. Secretary Dr. Phillips, if you don't mind, I'm going to just go straight into some of these seniors' questions because they sent them in, and so I want to ask them as they've written them. Miss Jolene Sims, she attends the Leo S. Butler Centers. She wants to know, when will they consider underlying conditions as a prerequisite for early vaccinations, no matter what your age is?
Oh, wow. Good question.
Yeah, so those are things that we're looking at, and I think as many know that we looked at the ACIP recommendations, and this is the committee that makes the recommendations to the Centers for Disease Control, and how we rolled out our initial priorities. Initially, it was hospital staff, personnel, as they were, high risk, and we wanted to make sure we keep that staffing component in place. And then we moved to the 70-plus population, individuals who are accessing dialysis, individuals who are receiving home care, and as well as the staff who was receiving home care. One of the next things that we are looking at, and there's been a lot of conversation on the federal level, is what does it look like for that 65 to 69 group, as well as individuals with chronic conditions, regardless of the age, as mentioned. And so those are things that are under consideration. We have not moved in that direction yet. Here in Louisiana, one thing to remember in terms of the chronic conditions is the number of individuals that we have that fall into that category. It's going to be more than half a state, depending on what chronic conditions that fall into that. The reality is we still receive a limited supply of vaccines. So
Oh,
while
right.
we are all anxious to be in the next group, the
Sure.
allocations have not increased thus far. So currently we received the last 2 weeks, the week-by-week allocation has been about 58,000 first doses. When you think about the number of individuals who have been in the first two rounds, that's over 600,000 people just even in this current tier of allocation. And so understanding what's the vaccine numbers we're getting in and the number of folks that are in the current group, we're just not meeting the demand in terms of that available supply from the manufacturers.
And Dr. Phillips, we saw in the news today that Louisiana is slated to get another 17% increase. Would that make a significant difference?
So we heard that as well. We are anxiously awaiting the confirmation of that. There has been some reports. We had a couple of federal calls that indicated that as well. The 16% that they have been mentioning on the news is across the nation, across all states. So that's the lump sum
Gotcha.
increase.
Okay.
And then they would allocate that by the pro rata share, the current allocation that they do for states. So we
Okay.
do expect some sort of increase here in Louisiana to that vaccine allotment. Again, is that going to be enough to say add in multiple groups? No. If they're talking about 16% across the state, currently they're producing about 8.6 million doses across Pfizer and Moderna. If they're talking about an increase of about 16%, that's about an increase of 10 million doses. So we expect, maybe that might be an extra 7 to 8 to our state, 8,000 a week. Again, until we get those firm numbers, we're not confirming it yet. But that is what the expectation will be.
And will Louisiana and Baton Rouge in particular, can we look forward to having mass vaccination sites in Baton Rouge? This is from Sandra Pressburg. It's one of my
Oh,
seniors.
thank you for that question, Ms. Pressburg. And so, yes, I know a lot of folks have been asking, where are the mass vac events? Why haven't we been doing it? And I think sometimes people get the perception because we're not doing mass vac events that we're not pushing out the vaccine. And some states have started with mass vac events. Here in our state in Louisiana, we know how to do that, and we know how to do it very successfully. We do that on flu drives. We were able to do it with H1N1. But we really started, and part of it was the type of vaccine that we received, Pfizer. So Pfizer required the ultra-cold storage. And we really shipped that initially to our hospital partners who had ultra-cold storage. The Moderna vaccine really was allotted initially for the long-term care federal partnership and doing some of the initial vaccine for our nursing facilities for those residents and staff there. As we've been able to get more of the Moderna vaccine into the community, we really did want to push out to pharmacies, community settings, FQHCs, and other providers, healthcare providers in the community to make sure we had some geographic spread. So not just doing one site, because we know everybody can't come to that same site.
Right.
And so how do we make sure that we're able to push out to the communities to get to where people are? As supply does increase, we absolutely intend to do mass vax events and partner with many of our community partners across the state. The supply just has not been there. The other piece that we want to look at doing is, in addition to hospital partners, doing the pharmacies and the clinics, as well as mass vac events, we still know that we're going to have locations across the state that are going to be gap areas that may not have a healthcare provider in their community, almost a healthcare provider desert.
Right.
And so we're looking at how do we provide, similar to what we did with those community testing teams,
Sure.
how are we able to place a community vaccination team in those communities so the community has access?
That's a great. I think that's an awesome idea. Miss Patricia S. Williams, she attends the Leo S. Butler Center. She said, I recently heard on national TV that it was safer to double mask. Place something like blue mask over your face and cover it with a cloth mask, or use 2 N95. We as seniors have difficulty breathing with one mask. 2 could cause us a problem. Could you tell us, should we do 1 or should we do 2, or what should we do?
I mean, we're still, and again, we see people wearing 2. We're still wearing 1 here. We have not received any CDC guidance that says stop the 1 mask approach and shift to 2 mask approach. I think it's what people are comfortable with until CDC would push out some additional guidance. Right now, the mitigation efforts still have remained the same.
So basically, keep your 1 mask on and don't fall out.
Yes, please don't. And if something changes, we will make sure we put out additional information in terms of here's what has occurred.
Okay, and Miss Paula McGrew, she lives in the Dumas house. She wants to know, I would just like to know if any plans are made to vaccinate at congregate living facilities like Dumas house where I live. If not, then why?
So is Dumas House, you'll have to help me, is Dumas House considered assisted living or just a congregate living site?
It's an independent living center. It's a congregate living site, but they're independent.
So there are plans, and so I think that is in tier 2. There are plans to make sure that we do vaccinate those individuals who are in those type of living settings. Right now, the current priority group, in addition to 70 plus, as well as individuals in home health settings and the dialysis, individuals accessing dialysis, or the nursing facilities and the assisted living, and that's through the federal partnership. But there are absolutely plans to make sure that we are vaccinating individuals that fall into congregate care, and that's in the next tier.
Okay, that's great. Well, that's great to know. She got the answer.
And we can get you guys, it may be helpful for us to put out some of the graphics in terms of the current tier and then the next tier.
And
you can use on your social media site.
Will also may be helpful for us, particularly for our seniors, maybe a one-sheeter where we can educate them, because we've had seniors to call and ask, is there an application? If my doctor doesn't have it, is there an application to apply for the vaccine? Does it cost me? Do I have to use my insurance? Just those kind of, a fact sheet, if you would.
Yeah, we absolutely can do that. What I would ask y'all to do is to also maybe collect some questions from your seniors.
We will.
That you see are some consistent ones that we can definitely tailor for their specific questions.
We got hundreds of them.
Oh, yes.
Okay.
All right, Dr. Phillips, this one's from Myra Head. I'm a retired nurse and want to help give vaccinations. Last week, Governor Edwards said one of the ways to get more vaccinations done was to ask retired nurses and doctors to help. Who can I contact to find out how to help?
Yeah, so we have the Volunteer Action Network, known as LAVA, and so we can definitely push that information out to you all, where individuals are interested in volunteering, especially those the clinical background and expertise. We definitely will need assistance when we move to the mass vac events. Okay. That's part of the reason why we have first responders who have the capability to vaccinate as a priority group. We're also working with the schools of allied health, so those students and faculty are getting vaccinated so they can actually provide vaccines when it's time for those mass events. And so the next group, of course, they're absolutely those volunteers. So we can push you all out the information so you can post it online for individuals who are interested in volunteering.
And one other question Miss Carol asked, can I feel comfortable about being around and with other people that have been vaccinated, received both of their vaccines? Are they free to walk around maskless and free now that they've received both doses?
No, we're asking folks, even if you've received the vaccine, to please still follow the mitigation efforts. I mean, part of it is in terms of what is that asymptomatic spread, even with the vaccine piece. And so I think there is still research yet to be done on that piece. And so just because either you have been vaccinated and either you've received your first or second dose and someone has not, even if both of you all have, we are still asking and really promoting to still follow the mitigation efforts. Again, there's 3 new strains that are out. The research thus far believes that the vaccine will, can cover these, but research is still happening. So it really is important that people still follow the mitigation efforts. I mean, the vaccine will help us to reduce the number of hospitalizations and deaths, but we are still in the learning mode, and it's important that we really do hunker down on the mitigation efforts.
And Dr. Phillips, is the vaccine similar to the flu vaccine? Will it be something that you have to do annually?
And so what we're hearing about the Moderna piece is that it would be an annual vaccine in terms of, now the question is that going to be a 2 series or just a booster? And so again, those are still questions that are happening right now.
Okay. And the same thing for Pfizer?
From our understanding, I mean, that's still a question.
That's still in question. Okay, and then do you think that the other 2 that are on their way, Johnson & Johnson and AstraZeneca, are they reliable, and is it something that the seniors should consider? Because one, I can say, Dr. Phillips, one issue that we've kind of been having is what kind is it, and we're kind of saying, well, you have access to this one, it doesn't matter, and so is there any difference in them?
I don't think we can speak to the difference of the 2 that have not gone through the actual authorization use yet. Once it goes through that process, and we'll talk about Johnson & Johnson just because that one is probably slated to go first.
Okay.
What we understand is that Johnson & Johnson is likely going to submit sometime mid-February for authorization. If approved, then it would be available to states sometime early March. Again, once it goes through that authorization, part of what the ACIP committee looks at is what occurred in those trials and makes the recommendations based on that. And so, again, in terms of the seniors, it's going to be very important for us, for anyone, not just the seniors, to understand what were the data that came out via the trials and what's the recommendations from that. And so in terms of the current two, we absolutely know the efficacy around it, benefits for seniors and other populations. The other two, we have to absolutely wait till they go to the approval process to get that information.
And just in that same vein, can you explain to the seniors why it's important for them to fill out the registrations or whatever they're filling out for the vaccine, and add in their ethnicity, their race, why that information is important for you to collect? Because I can tell you, just looking at some of the information, they haven't been doing it, and why should they do it?
No, thank you for pointing that out. We that is something that we are trying to do better with, and we're going to need the help of the public to make that happen. One piece is really important to actually fill out the registration pieces, because both of these current vaccines, Moderna and Pfizer, are a 2-dose series. And so we need to make sure that we're accurately tracking who received what and then the availability of the second dose. So it's really critical that people put accurate information in terms of their email, phone number, name, address, so we can truly be able to follow up with them, that pharmacy that actually delivered the first dose, to be able to follow up for the second dose and setting those appointments. The second part of your question, in terms of the race and ethnicity information, it really is important as we're talking about equity. To understand who has received the vaccine and where we may need to adjust in terms of where those allocations are going. How do we target our message? What the message needs to be? What are the questions that are out there by the different communities? So I think right now, I think most of you have seen that we rolled out our initial demographic information as it relates to vaccine that provided information in terms of region allocation, race, age. And in the race data, we saw that 9% of African Americans received the vaccine. And when you look at it, 33% white, 38% other, and I think 18% unknown. And so we know we have some work to do between that other category and the unknown. And so we really are asking people to try to put that information in as accurately as possible, so we understand how we need to adjust in terms of where vaccines are going in an equitable manner, as well as our communication around it. So thank you for pointing that out, because that really is a critical piece.
And why is it critical and important for the seniors to consider having it anyway? Because we have been spending countless hours discussing with them why it is important. But maybe it'll be better to hear from you why it's important that they consider taking the vaccine, and why, if you're in the Black and brown community, why it's doubly important.
Yeah, well, health equities across the nation have existed for quite some time, and we see it not different as it relates to COVID. So it hits the Black and brown communities much harder, and it hits the seniors much harder. So when we talk about where the greatest impact is, it's age and race. And so in terms of making sure we account for that in terms of pushing out and reducing the hospitalization and death numbers, that has to be a large focus, and we need to be intentional about it. When we look at the high rate of hospitalizations and deaths, it's a senior population. And so that is why they have been a prioritized group in terms of both the ACIP recommendations as well as here in the state. ACIP's initial recommendations were 75 plus. The governor here looked at our data and dropped it down to 70 plus based on our hospitalization rates for those who are 70 and older. And again, the next conversation is the 65 to 69. And the same thing when we start to look at race in terms of that impact. And so it really is important. I know, there's a lot of angst, especially in the Black and brown communities, just because of historical situations. And we have to recognize and acknowledge that. That's not something that did not exist. It occurred. We have to acknowledge it and really to encourage people to, find a trusted party who's reviewed the information, who can review it for you from a clinical perspective. If you have health conditions and you want to talk to your provider, seek out those people and get the information. But what we can't do is let the fear of the past prevent us from getting the information we need
now that's
to
a
combat
word.
are to date.
Now you preaching now,
All
Dr.
right.
Phillips. You preaching now. So listen, and then we're not gonna keep you because we know you having a lot of time. And so my last question is the question that we got the most from about 50 people, and I probably emailed it to you myself directly. When are you gonna let us open the senior centers? And then
It's not when I'm going to let us open the senior centers.
When will
It is
COVID?
let me answer that.
that.
It is when we, as Louisiana,
All right.
do what we need to do to get the rates down in order for those things to happen. I,
Okay.
like everybody else, my team, we want as much normalcy as possible.
That's right.
We want things to go back. I mean,
Uh-huh.
you know, a couple of weeks ago, our percent positivity was above 13%. This
Uh-huh.
week, we're at for a statewide, we're at 10.3%.
Okay.
East Baton Rouge is at 9.5%.
Uh-huh.
And I wanted to think back on that because some folks were like, 9.5, that's not that bad. But think about, you know, the week of between September and end of October,
Where were
East
we?
Baton Rouge Parish was less than 5%. We're
wow.
not in a good place. And I think we've been gone so long that people are tired, and so we got kind of complacent in terms of where we are. Like, okay, not so bad, 9.5, under 10. No, we're not good.
So
The
are you
virus
saying
is out there.
we're getting worse and not better?
You know, we got some work to do. You know,
Got
the
some work to do.
holidays impacted us tremendously.
Okay.
I mean, you all see the hospital rate, the number of deaths that occurred,
Right.
and our percent positivity. You know, we're in the third wave. The impact of the Thanksgiving, Christmas, and New Year truly impacted us as a state and as a nation. And
Right.
so things will open when we together, as the public, do what we need to do to make it happen.
I just had to ask the
So I'm asking for y'all's help.
Okay, Dr.
Right.
Phillips. So what do you need us to do? Tell them what you need them to do.
I need y'all to help continue to push messaging out. Talk to trusted sources in terms of getting information in terms of as it relates to the vaccine.
Right.
Just because you know somebody that posts something on Facebook doesn't mean that information is accurate.
Amen.
Try to find an accurate source. I know the Council on Aging is pushing out accurate information. You know, CDC, our website. Find
Right.
someone who you can provide. Who can provide you information that you can ask questions,
Right.
educate yourself about it, and then make a decision for you and your family.
Right.
In the meantime, until the vaccine becomes available for you, help follow the mitigation efforts. No matter how tired you are,
That's
I'm
right.
tired too. I just moved back home like I shared with y'all in
Yep.
April. I'm anxious to see family, friends,
I know.
have a Baton, sit down and eat crawfish. But it can't happen right now.
Right.
Because I don't want to just be for today. I want to be for the future. And so we need the help of everybody to make that happen. So it's really, you know, doing your research, doing your education on the vaccine, making that decision that's best for you. And again, I think when people do the research and the education around it, they will see that is the best choice for them in terms of where we're headed.
Well, Dr. Phillips, we want to thank you for coming on the show, taking your time. We know you are very, very, very busy. We know you have been slammed with this virus. We want to thank you for the work that you've been doing for the state, representing not only the state but our community. Thank you for the work that you've been doing for the seniors. And we just want you to know, if nobody has told you, we appreciate you.
Yes.
Keep up the good work. Keep up the good fight. And if you ever need some support, you can always call on the seniors of this parish because we got your back.
Well, we appreciate it. You know, I'm going to ask the seniors for one thing. For
Okay.
those that are prayer warriors, go ahead and keep me and the team in their prayers.
We will.
This is a heavy
Will
lift
do.
for our state, and we need that support to get it done.
Amen. Amen. Thank you,
All
Dr.
right.
Phillips. We appreciate it. And we look forward to hearing from you some months from now when the number is way down.
When it's way down and we're able to get out and about, I might have to come to visit y'all at one of the senior centers.
Yeah, there you go. There
There
you go.
you
Come
go.
visit us. All right. Thank you so
All
much.
right, thank y'all.
All
Thank
righty.
you.
Bye-bye. All right, y'all heard it for yourselves. You heard it from Dr. Phillips. What a great interview.
Yes.
She had some great information. Seniors, I know it was a lot. It was vast, and what I would suggest is, because this is recorded, go back and, you know, listen to it again.
Right.
Replay it, listen, redigest the information, and you may even want to listen to it with your family members, and so you can make some critical decision as it relates to one. Are you going to get vaccinated? It's
Right.
important.
It's
You heard her. You know, it's our community. It's black and brown people that are suffering and dying from the disease the most. And it's a reason, you know, that's a thought. That's a reason that you may want to consider to have it, right? And also, do what you need to do as the matriarch, as the leader of your family, and remind your family members, you know, do the things that are important. Keep your mask on. You know, stay in the
Social
house.
distancing.
Stay inside.
Yes.
I know they got this song say I want to go outside, but you might have to stay inside a little longer until Baton Rouge can get its numbers down. Because I saw it the other day. They said, all right, we worse than New Orleans right now, and we have the worst numbers in the state. Actually, we're pretty bad, and that's because, you know, we in the clubs, we in the end zone, we all over the place, you know, because we can't take it no more because we want to go outside. So we're going to take a quick break. We're going to answer some. When we come back, we'll answer some seniors' questions. We're going to give away some prizes because, look, I'm going to ask some questions. We're going to talk about our garage sale on Friday, our social distance garage sale on the 29th and the 30th. We got all kind of stuff that we selling at the Capital City Event Center. 6955 Florida Boulevard.
There you go.
We got a bunch of stuff: chairs, tables, plates, forks, all kind of stuff.
Nice.
Pool tables, all kind of stuff we're gonna be we getting rid of because we moving to the Lotus Center anyway. So we'll be right back. We're gonna take a pause for the calls, pay some bills, as they say. All right,
we'll
thank you. We'll be right back.
Council on Aging, serving seniors. The Council on Aging, serving seniors.
And we are back. We are back. Seniors, if you got questions you want to call in. If you have any thoughts as it relates to Dr. Phillips and what she said. You can call in.
Very informative.
Very informative. Tim, she left us with some information, didn't she?
Yes, there's a couple of seniors calling in asking how to volunteer. So everybody that's interested in volunteering to.
If you former medical, right?
Yes,
Not just
former nurses and former doctors.
Don't go faking like you're a nurse or a doctor.
Yes, they're looking for assistance in administering COVID-19 vaccines. And volunteers can email dhhoc03@la.gov. Again, it's dhhoc03@la.gov, or you can visit www.lava.louisiana.gov. Again, that's lava.dhh.louisiana.gov.
And we're gonna put that up on the NGL's gonna put it up on the page so that you all can see. Now listen, if you were listening, call in and we're gonna see if you were listening. If you answer a question or two right. You can win this what's this Echo Show? Echo Show. We got tablets today too, Trudy.
Yes,
Trudy told me not to do tablets today. But I got I roll with the tablets. We got tablets today. Look, she breaking them out. We got tablets. We can do a couple of tablets today. So let's see who was listening to Dr. Phillips. Wasn't she just a breath of fresh air?
She really
right?
was.
Homegrown, right out of this city from Baton Rouge. Making us proud, representing for our state. And the thing is, Dr. Phillips was in Texas, right?
Okay.
She was their secretary of their health department in Texas, and they asked her to come back. Now she was in Texas and she was, doing bigger things with a bigger state. Of course, everything come big in Texas, including the paycheck. But she wanted to come home and work for her community.
Look at that.
And what a testament for that. She wanted to come home and help her family. And so, everybody don't do that. There's a lot of people chasing the money. Right. And she came home to help her community. So let's make sure we do the one thing that she asked us seniors. Let's keep her lifted in prayer, because I know we got plenty of prayer warriors. Let's see the phone ringing, Trudy. Let's answer some calls. You answer, Trudy.
All right. Lotus on, who are we speaking with?
Mary Thompson.
Hey, Miss Thompson.
Miss Thompson, how are you doing?
Oh, I'm good.
Good.
Did you get vaccinated, Miss Thompson?
Yes, I did. I get my second one on Sunday.
All right.
Okay.
Did you get an opportunity to listen to the show?
Yes, I did.
And what did you think about what Dr. Phillips said? Tell me something she said that resonated with you.
Well, she gave us a lot of information telling us about the how we have gone from 5 before the holidays to 9.
That's right.
Something, and letting us know that we should be more careful.
We got to.
During this time, because a lot of people just decide they want to go out and party and everything else.
That's right.
And forgot about taking care of themselves.
That's right.
Right.
Folks been slipping, huh, Miss Mary?
Yeah, they slipping. But it's not a good thing. It's not a good thing.
It's not, because if we don't bring the numbers down, then I can't let y'all come back to the senior centers. And besides that, we just can never get back to some normalcy.
Right.
Everybody want to go back to normal. I don't know about you, but I'm tired.
Yeah, they want to get out of the house, but we're going to have to wait till we bring it down.
We got to bring it down.
If we do what they say do.
We could probably bring it
Wear
down.
your mask and stay social distance, which a lot of them not doing.
Yes, ma'am.
Wash your hands and
Yes, ma'am.
do the things you're supposed to do.
Yes,
Then
ma'am.
we can bring it down. That's the only way we're going to bring it down.
Yes, ma'am. Now, Miss Mary, have you won a tablet before?
Yes, I have.
But you ain't win this Echo, huh?
No, I haven't.
Well, you just won it today, Miss Mary. You won the Echo Show, all right?
All right.
Okay.
All right, Trudy,
Congratulations.
you can pick it up.
Okay.
You can pick it
Where I
up
pick it up at?
tomorrow at 17:01. All right.
Okay.
You can pick it up tomorrow after 1 o'clock. All right.
Okay, after 1. Thank
Yes,
you.
ma'am. You're welcome.
You're welcome.
All right.
Okay.
Nice call.
Bye-bye.
All right.
Welcome to the Lotus Zone. Who am I speaking with?
Hi, my name is Melody Bayham.
Hey, Miss Bayham. How you doing? That's a new name.
Yes, I'm doing great.
Good. Have you been vaccinated, Miss Bayham?
I'm not old enough.
You're not in that group yet.
You're right.
All right. Oh, did you get an opportunity to listen to Dr. Phillips?
Yes,
What'd you think?
I did.
Did she give us some great?
Very informative And
What'd you take away? You took away anything?
yes, that we have to continue to wear the mask because, you know, it's going to help people not be, you know, if they catch the virus, it won't be as bad. And then other people who don't have it, you still need to wear it.
Right. Who hadn't had the vaccine?
Yes.
She did say that.
Yeah.
Okay, have you won something from us yet?
No, I like a tablet.
Okay, you just won the tablet. Yes, ma'am. You won the tablet. Okay, you can pick it up tomorrow at 1:30 at 1701 Main Street. All right.
Thank you.
All right.
Congratulations.
Come on, Trudy. Let's
Thank
get
you.
one more call in.
All right. One more.
Welcome to the Lotus Zone.
Who we
Who we
speaking
speaking with?
Eula Franklin.
Hi, Miss Franklin. How you doing?
Hello.
Hey, Miss Franklin. Miss Franklin, you done won everything we got,
I
Miss Franklin.
know.
But you one of my, you are A1 from day one.
Yes, a super fan.
Super fan. Miss
Just
Franklin,
about.
how was Dr. Phillips? What you take from her?
Oh, I really enjoyed her.
Yes, she was good, huh?
She really was, and she gave us a lot of information.
And she know that
And,
stuff, huh?
and I'd like to say to the seniors, please don't be afraid to take the shot.
They so afraid, Miss Franklin. Why they so afraid?
Encourage them.
I don't understand.
Have
but
you-
please.
Did you have yours, Miss Franklin?
I most certainly did, and waiting on my second one.
Okay.
good,
All right. And
good.
you ain't had no problems, huh?
None whatsoever.
I had one senior call me. She say she can't take that because she don't have no room to grow no extra toes and fingers.
Well, I don't need any extra ones, but I had no problems with it.
Well, good. I'm glad you
Good.
called in to encourage them. Thank you so much, here, Miss
Thank
Franklin.
you.
We
You're
miss
more than
you here.
welcome.
We miss you here.
And I miss you all. Too.
All right,
Yes,
Miss
ma'am.
Franklin. All
Thank
right.
y'all for everything y'all do.
All right.
Thank
Bye bye.
you. Bye-bye.
Bye.
Last call of the day. Welcome to the Lotus Zone. Who am I speaking with?
Encourage them. Thank you so much, everybody.
Welcome to the Lotus Zone. Who am I speaking with?
Hello.
Hello. Who am I speaking with?
Hello.
Frankie Fiston.
Okay, turn
Hey,
down your
turn
radio.
down your radio, Miss Sims.
Okay.
We
Okay.
we asked your question today.
I know.
We
I was
did.
so happy.
Yes, ma'am. It was a really, really good question. It was a great question. So
Thank you.
have you been vaccinated, Miss Sims?
I'm not old enough.
All right.
That's why I asked the question.
That's why you asked the question.
Okay.
Uh-huh. And what did you take back? What information did you take from Dr. Phillips' interview?
That it's going around where we need to mask up twice, and she said we really didn't. We just still wearing the one, and we'd be more informed when that criteria has changed.
When CDC say, huh?
Right.
Yeah.
All right. Well, look, you just won this Echo show today. All right.
Oh, look, can that be added? Because I'm homebound. I get
homebound.
Meals on Wheels.
Oh,
And,
okay.
and my route comes on Friday.
You know what I'm gonna do? I'm gonna send you. I'm gonna send you a tablet.
Yeah. I have a
You got a
tablet.
tablet, so you want to add it? Okay, I'm gonna send you this. Okay. You got somebody gonna help you hook it up?
I'm homebound. Oh, the Echo Show?
Yes, ma'am.
Comes on Friday. I have to find somebody.
All right.
But it'll come with my Meals on Wheels.
Yes, ma'am.
Friday?
We'll send it to you with your Meals on Wheels. All right.
Okay, thank
All
you.
All right. Thank you for listening. Here, have a good evening.
All right.
All right.
Have
All
a blessed one.
You
You
too.
too.
All right.
You too.
Bye-bye.
This was the good thing about this show. You know, we got everybody. We got the homebound. We got Meals on Wheels. We got the people from the senior center. All kind of seniors listen. Don't y'all miss the garage sale. Look, Thursday, if you want to get some, Friday and Saturday. Also, if you're in the 70 plus club, we have some vaccines in the North Baton Rouge area, the Jules J. Newman Community Center. We're doing 100 people. I know that the care managers have been calling. And so if you haven't gotten anybody, you can dial. What's the number, Trudy?
225-923-8000.
Ask for Shan.
Ask for Shan.
Call and ask for Shan. Thank y'all, seniors, for
Thank
listening
you.
in. Please take the information that Dr. Phillips shared with us today. Take it seriously. Do what she said do. pray about it. Let's keep her in our prayers, and
Yes.
we'll see you next week, Tuesday.
Next Tuesday.
Next Tuesday.
4 o'clock.
4 o'clock. All right.
All right.
All right, seniors.
Good
Y'all have a
show.
good day. It was a great show.